Coverage now, that mystery illness in children that's been linked to the coronavirus is pretty scary stuff. Doctors in Connecticut are keeping an eye out for these unexplained infections that target kids from toddlers all the way up to young adults. Channel 3 Eyewitness News reporter Patricia Del Rio joins us now live from Hartford. And Patricia, tell us about the symptoms. It's scary stuff, right?
It certainly is. But the thing that's most unusual about it is that the symptoms vary from child to child. This can include rash, it can include fever, it can include what looks like pink eye, swollen glands, all sorts of different things. And so sometimes doctors might not connect those things to being possible coronavirus symptoms, but they are now saying they could well be. It's a serious infection doctors across the country are seeing in some kids, and it may be connected to the coronavirus. An unusual infection with symptoms like fever, rash, conjunctivitis, and sometimes enlarged lymph nodes. They first started showing up in European countries and now in the U.S. An inflammatory illness seen in patients as young as toddlers and even young adults. Some children tested positive for COVID-19. Meanwhile, others tested negative but showed antibodies for the virus, meaning they might have previously had it.
That to me is an indication that perhaps this is not the cause of the acute infection, which when they would be contagious, but it's probably post-viral.
Many of the symptoms mirror an illness called Kawasaki disease, known for swelling in blood vessels of pediatric patients. Doctors also seeing toxic shock-like syndrome with symptoms including vomiting, diarrhea, and low blood pressure.
It is entirely possible that over the next 1, 2, 3 weeks, we will begin to see some kids, and I'm going to emphasize a few kids that may have this type of presentation.
So a bunch of these cases have popped up in the United Kingdom, and there have been cases in New York and Boston and in other parts of the country. So now the onus is on pediatricians, if they see these types of symptoms, to think about it in terms of COVID-related illness. We'll have more on this coming up in the next half hour. For now, we're live in Hartford. I'm Patricia Del Rio, Channel 3 Eyewitness News.